Okay. So hi, my name is Kayla, and I'm a student from Nova Southeastern University, and I'm completing my capstone project with Coralyn and helping out with Cooper Neurology as best as I can. And I wanted to thank you all for your time today. And I will be presenting on the daily living strategies for individuals with HD from an occupational therapy perspective. Oops. So I first wanted to mention the two different resources that I have been working on during my time. As Coralyn had mentioned, I'm working with her on the resource guide for the New Jersey chapter and updating that. It would be definitely beneficial for all of you. And the different types of things that we have included so far are different social service agencies within the county. There's information on support groups and counseling, driving evaluations, long-term care, information about the brain donation, and help with medications and finances. So this will be posted on the website soon. We are in the process of finishing it up. And the other resource that I've created is a booklet that has all of these topics on different equipment, activities of daily living tips, fall prevention strategies, cognitive, postural, motor-based, and mobility strategies, different types of therapy, and some mental health tips. This resource is available in a physical copy in the Cooper Neurology office, but also virtually. So if you are interested in it, you can always reach out to Coralyn and she can send you certain parts of it or the whole thing if you'd like. So what is occupational therapy? Occupational therapy is an evidence-based healthcare profession and part of the rehabilitation team that assists individuals across the lifespan and aims to solve problems and barriers that interfere with a person's ability to engage in activities meaningful to them, known as occupations. OTs provide the most effective treatment that is up to date with current research, and it is client-centered. An occupation is an activity that holds meaning and provides purpose within your daily life. So these can be things that you want to do, need to do, or you're expected to do based on your role in the family or within the community. Some examples of occupations include driving, handwriting and typing, cooking and meal preparation, taking care of a pet, dressing, gardening, grooming tasks, and all of the leisure and social participation activities. There are 8 areas of occupations that OTs address when working with a client. We work on the activities of daily living, ADLs, instrumental activities of daily living, IADLs, rest and sleep, education, work, leisure, play, and social participation. So to break down what are ADLs, they are bathing, dental hygiene, toileting and toilet hygiene, eating and feeding, dressing, and transfers and mobility within the community or in the home. And IADLs involve cooking and meal preparation, house cleaning, taking medication and managing the medication, laundry, shopping, personal finances, communication, and transportation. So these are all areas that OTs can help with. So generally, there are 3 types of therapies that you will come across within the span of HD. And these include physical therapy, occupational therapy, and speech therapy. Each therapy has its own scope of practice. We all have our own expertise, and we work on different goals, but we all work together and we collaborate to meet the best needs of that client. So for physical therapy, they use a biomechanical approach to improve ability to perform movement. They utilize therapeutic exercise, mobility, and manual therapy to help a person get from point A to point B. Occupational therapy utilizes a holistic whole person approach to improve the ability to perform ADLs to maximize function and independence in the environment, routine, roles in an activity. And we use the supports and identify and navigate the barriers to help a person do things at point A and point B. And speech therapy improves the ability to communicate and works on cognitive and thinking skills, chewing and swallowing, language skills, and memory. And they will also sometimes use augmentative and alternative communication devices. So to receive OT services, and generally any type of therapy services, a physician's script or a referral is typically required. It is a covered skilled therapy service under Medicare. And so for OT, we work to create and promote occupational performance, modify the task and environment through compensatory and adaptation strategies, provide assistive equipment and make recommendations when appropriate, establish and restore a skill or ability that has been impaired, and provide patient and caregiver education. We may work on things like therapeutic exercise, ADL training, balance and fall prevention, home modification and home safety evaluations, cognition, motor planning, and mental health. And generally for all of these therapies, we like to see people right at the beginning of a diagnosis or to prevent a lot of the issues that may occur and just slow those down in the best way that we can, rather than seeing them after a fall or after you're having a major issue. These are the different types of areas that an OT would work with someone with HD. So for cognition, we work on the activity and the demands of that activity and being able to shift and maintain attention, as well as short-term memory, understanding medication schedule and organizing the medication, initiation and termination of tasks, learning a new task, mental health, and establishing a daily routine. For chorea, we work on the coordination of fine motor tasks that may be affected by the chorea, such as grooming, feeding, leisure activities, and medication management, and being able to open bottles or open containers. And understanding what areas of your life might be impacted by this and the decreased coordination, such as in your self-care or if you're working, and any function and safety within the home. We also work on balance. We will make recommendations on adaptive equipment for hygiene, such as bathing and meal preparation. We work on exercise and balance training and advocate for equipment and assistance when utilizing mobility devices. And that's where it comes into play with physical therapy, is that we collaborate. They will determine what device is best appropriate, and then we will help you to utilize that device within the community. We also work on engagement and meaningful activities, such as establishing activities that are important to the routine or the role of the person. If it's important for you to be able to take care of your dog, or to go get the mail every day, or to clean the house, we'll work on adapting those activities to meet your needs. And we will always work on modifying the activity, not necessarily modifying and changing the individual. We also work on visual perceptual skills, which is utilized for functional mobility and navigating your environment, as well as during driving and initiating the dialogue of how to prepare for retiring from driving if that is becoming an issue. Home safety assessments are done by OTs. We will complete a home walkthrough using a checklist and identify any hazards within the home and recommend any modifications or adaptive equipment. And we will look at all areas. So with the floor, is there clutter or wires, any throw rugs or uneven surfaces? We will look at the lighting in the stairway, hallway, throughout the home, inside and outside, and if it's easy to find the light switches. Outside, we will look at the walkways, even pathways, any slippery surfaces, and if there's any tools or anything blocking you from your direct path into your home. And at the furniture, to make sure that it's steady and that all of the items that you need are within reach, as well as having handrails on the stairs or maybe the bed and maybe some grab bars in the bathroom. If a person is homebound and spends most of their time in the home, and an OT can see the benefit of further interventions within the home, then they will recommend in-home skilled therapy services. The visual environment is also very important. Having a direct route to get from one place to another is important, so not having that coffee table right in the middle of the room, but maybe to the side, and also having cue cards if there's a certain task that is difficult to complete, or a visual schedule. So it can be done in several ways. You can have, 4 words to fasten a button. Grip the button, find the hole, push button into hole, and pull. If getting up from a chair is an issue, then you can have more detailed written instructions, or turning in bed, as you can see in the middle. And then you can also have a visual schedule. So for brushing teeth, for example, where you have a picture and then you have the steps. That also helps with the cognition piece. These are some strategies for cognition: creating a daily routine as best as possible, providing cues, doing a gesture, a verbal cue, a physical cue, or tactile, which is touch, labeling frequently used drawers and cabinets, short, concise, when giving directions, to reduce distracting stimuli as much as possible, to create lists and calendars or notes to keep track of any tasks, and to break those complex tasks into more simpler components, utilizing the visual schedule or cue cards, and to always encourage completion of one step before moving to the next. Some postural control strategies: we really focus on the person being self-aware of posture and being able to just give a verbal cue of sitting up straight, or just saying the word posture to go from leaning to a more upright position. High-backed chairs with armrests are very helpful. They provide support, and also the armrest will help you to get in and out of the chair. If you are watching TV or watching anything, we recommend having it directly in front of you rather than to the side to prevent that lateral lean. And using a chair raiser or an electric chair that rises for easier transfers getting up and down. Exercise and balance is very important, as we know, with OT and HD. And with HD, exercise that might be worked on is flexibility, balance, cardio, core strength, lateral, which is side-to-side movements, and squats. And active range of motion exercises are used to prevent muscle or joint contractures and can be completed lying down or seated in a supportive chair to maintain balance. If you have any pain with exercise, you should always stop, and also to limit the use of weights and to use your own body when exercising. So that goes into functional strength training to maintain your strength. Simply standing up and down from a chair is using your own body to maintain that strength rather than using weights or anything resistive. Lifting an object onto a shelf, or using something that is a push-pull method. And OTs may also work on positioning of feet and different balance positions, various head and arm positions when you're doing that, as well as standing on different surfaces. We always incorporate a functional activity into balance training. And all balance activities should be discussed, obviously, with a physician and a therapist based on their care and recommendations. So I'm going to go into just different areas of your life and some strategies that may be helpful. An OT is definitely a valuable team member in addressing function in the workplace. That is an occupation. We can work with communication with the employer, providing accommodations and modifications for the task, and also advocating for your rights and making sure that you know your rights through the Americans with Disability Act. Some strategies in the workplace, although it can be difficult depending where you are to reduce distracting stimuli as much as possible, maybe modify some of the responsibilities or the task and utilize adaptive equipment if that seems appropriate. Consider changing employment to something more accommodating, or possibly consider different volunteer positions to keep you engaged in the community, and to reduce the responsibilities that might be too fast-paced, detail-oriented, or with variable conditions. For driving, OTs can receive a special driver rehabilitation certification to administer comprehensive driving evaluations. This is done in the office and also a behind the wheel assessment to assess the physical, mental, and visual abilities for safe driving. We look at reaction time, visual acuity, decision-making, judgment, and planning, which you need all of those for driving. The physician will do a medical assessment and determine if an OT is needed for a behind the wheel and further assessment. So we provide the functional assessment. We will also assist and initiate the dialogue for planning retirement from driving if we don't see driving as appropriate at that time. Based on the performance, we will work with the individual to create a plan, recommend strategies, equipment, and training, and increase awareness of resources for alternative forms of transportation. For social participation, It's very important, especially during this time and in the pandemic when social participation and communicating with others is limited, to create a daily routine for yourself and to maybe schedule times to talk to other people, whether that's through video chat or talking on the phone, taking time to write a letter or email to someone. It's also good to have different visual and verbal reminders for yourself to do that and to participate in different events and different support groups. Leisure activities, maybe thinking back to hobbies that were of interest to you and things that you used to do that maybe you would be interested in doing now, or things that you're already working on now and things that you might be interested in the future, taking the time, especially now, to do that. We know that exercise is important, and exercises such as Tai Chi and yoga are also very beneficial. This is a quote from an article that I really liked. It says, "Ensure that the activity is adapted to fit the person and not the other way around." And this is the true essence of what OT stands for, is we adapt the activity and the environment. And we want to adapt your surroundings to fit your needs, not fitting and changing you to fit the world. For home management, for doing laundry, let's say, some strategies are to use a timer for when it's complete. You can use a laundry basket with wheels or a handle or a shoulder strap. And you can be in supportive seating and use a reacher to reach in and out of the washer and dryer. For meal preparation, doing one task at a time, because meal preparation is exhausting and also requires a lot of attention. And having supervision when you are doing meals on the stove and the oven, as well as maybe moving to more simpler meals that require 1 to 2 steps, utilizing a lot of the adaptive equipment, which I'll talk about in a moment, and having all your frequently used items within reach. So I know last year when I did a presentation, I focused a lot on the equipment. So I have it all here and I'm going to go through it. But if you have any questions specifically, feel free to ask. So for dressing, there's using Velcro or elastic waistbands, a long-handled shoe horn for taking on and off your shoe, a dressing stick, which can be used to get behind you or to reach down, elastic shoelaces, and a sock aid, which I actually will have a picture on it on the next slide. And then for toileting, there is a 3-in-1 commode where you can have it at bedside as is like that. You can also remove the bucket and just put it over a toilet. So now you have a raised toilet seat. Or if you have a toilet already that you wanted to put bars on or raise, you can do that as well. The Freedom Wand can be used for toilet hygiene and for different bathing and grooming activities. For dressing, some strategies are to sit down when you're able to decrease your fall risk and for supported posture and balance when you're reaching and bending, and to pair and label outfits together ahead of time. There are several adaptive clothing lines out there. This one has magnets behind the buttons so that when you're putting on a dress shirt, it's easy to open and close. It's something that you can probably do on your own as well, and I'll just show you what that looks like. So just a simple thing that you can do. And also this is how to use a sock aid.
Sit at the edge of the bed or in a supportive chair with armrests. Place the sock aid between your legs. Bunch the sock up as if you would a stocking. Then slide it onto the tip of the sock aid. Pull the sock up over the sock aid, stopping just before the knots on either side. Drop the sock aid to the floor while holding on to the rope handles. Slide your foot into the sock aid and pull the handled ropes back and up so that the sock slides up over your heel. You can shorten the ropes by wrapping them around your hands once or twice if necessary.
Okay. For bathing, there are shower chairs that have detachable armrests you can put in a shower stall. A tub transfer bench has the 2 legs outside of the tub, so you can sit and then swing over your legs. Grab bars, it's very important to have grab bars properly installed and not using suction cups, ones that may fall and then cause an increased fall risk. And a long-handled sponge. For grooming, there's also using an electric toothbrush or a toothbrush or razor with a built-up handle. There's also different devices out there called Easy Holds, which you can use on several different items for a little bit of an easier grasp on some of those smaller items. Medication management. We work on organizing your medication and being able to use the different management devices. So using a pill box, they have ones that have spring-loaded assistance, so it's a little bit easier. There's also vibration timers where you can actually store the medication in the timer and then it will vibrate and make a sound when it's time to take it. There are several pill reminder applications on smartphones, as well as the Hero pill dispenser. It is definitely more costly, but it does automatically dispense your medication. You have it set up through your phone. It will dispense it at the proper times. The oral flow is good for swallowing. The medication goes into the spout, so it never actually sits on your tongue. You fill the cup up with water and then just drink it as if you're drinking water, and the pill will go down easier. And also using a high contrast tray, like a black plate or a red plate, when you have lots of medications that might be all white and it might be hard to differentiate. For eating and feeding, using weighted utensils, they make ones that have a wider grip, like the first picture there on the left, and then next to it, those are also weighted, but they look more like standard utensils. A universal cuff goes across your palm, and you can put a fork or knife or spoon into it. A rocking tea knife has a wider grip and allows you to do a rocking motion to cut food. A plate guard goes on the edge of the plate to prevent food from falling off. And Dysum is the blue mat. It prevents things from sliding off of the surface, so it's kind of like a placemat. They also make bowls with like a high side if food spillage is an issue. And speaking with the speech and language pathologist to see what the best thing to do for drinking is, but they do have nosy cups that have a higher side for when you're drinking or using a bendable straw. For eating and meal times, weighted utensils provide that additional weight to stabilize hand and support and weakened grasps. They also are about a half a pound each. Individuals with HD may require a high calorie diet, so that's important to keep in mind. We encourage people to eat at the table to reduce spills, promote social interaction and conversation with others, and to reduce distractions, and to prepare meals and snacks in advance so that you can retrieve them easily throughout the day and not having to take the time to create a meal each time. And we also promote as much independence during meal times as possible. For transferring, there are things like a transfer board, a bed rail, a power lift chair, and there's also a bed cane. For mobility, we encourage to plan scheduled rest breaks throughout the day and to plan out the day and prioritize your activities during the days during the times of day when you have most energy. A recumbent bike is a good adaptive bike that's good for exercise. There are also trekking poles, which is good for walking. There are several types of canes and walkers and wheelchairs. So they all have different handles. We have the C cane, functional grip, offset, the quad cane with the 4 prongs, and they also have folding walking canes. And for walkers, we have a standard, a 2-wheeled, and a rollator that has 4 wheels, and then the basket. And typically these are covered by Medicare every 5 years. For wheelchairs, there are manual wheelchairs, transport wheelchairs, which are lightweight, easy to fold up, high back reclining wheelchairs, and power chairs. This is just a short video of how to get in and out of bed doing a log roll.
This is a demonstration of a patient rolling from supine to sideline and then sideline to sitting. Have the patient bend the right knee and push down on the right knee at the same time reaching across the body with the right hand to achieve a sideline position. Once the patient's in sideline, have them bend the left elbow And push down with the left elbow and with the right hand. And bend the knees so the feet go over the edge of the table. At the same time, the feet go down, push down with the hands.
And then this is one for getting from a chair to another surface.
Today we're going to show you the proper way to transfer a patient from a wheelchair to a medical table. This type of transfer is called a stand pivot transfer. This is used when a patient can stand but may be a little weak or need extra help. For your safety and the safety of the patient, always use a gait belt. The belt should be placed low around the patient's stomach at about the height of the belly button. Be careful to watch or ask the patient about any recent abdominal surgeries or colostomy bags. In those cases, you may have to place the belt higher or lower to avoid incisions or devices. If you are transferring from a wheelchair, make sure the brakes are locked and the leg rests have been swung out of the way or removed to avoid any possible skin tears or tripping. Make sure the chair is at about a 45-degree angle to whatever surface you are transferring to. Have the patient scoot their bottom towards the edge of the seat. Explain to the patient exactly what you plan to do and what you need from them. Stand in front of the patient with a hand on either side of the belt. Squat to use your legs to lift, not your back. On the count of 3, help lift the patient to a standing position. Have the patient shuffle their feet until the back of the patient's legs are touching the table. Tell the patient to reach back for the table and have a seat. Make sure the patient is safely on the table and then remove the gait belt.
Okay. And for the last of the adaptive equipment, for daily living tools, there are things such as a key turner, a reacher, a jar opener, page turner for reading books, and a universal turning handle, which can be used on a stove or a microwave. And an enlarged and brightened keyboard. There are different typing aids and also several accessibility features on smartphones. For mental health, COVID-19 has had a mental health impact on everyone. Media outlets display the continuous coverage. You might be worried about securing food and household items and medications. You may be unsure about the safety of caregivers, transportation, procedures, and appointments. There is a decreased social interaction with others. There is definitely a halt of daily routine, habits, and roles, and an exacerbation of mental health conditions may result of this. There is an act that was re-amended in 2020 called the Older Americans Act. It's just good to know about. They are working on funding, resources, support for caregivers, including education and respite care, pension counseling, nutritional services, disease prevention, and community workforce training. NOTs are important in mental health because we provide interventions, support, and programs related to community-based settings, health promotion, and disease prevention. We promote participation and encouragement in meaningful activities and recommend adaptations and modifications to the environment to support safe aging in place and reduce social isolation. And finally, some mental health strategies during this time are to create a routine as best as possible, having something to look forward to that day or the next day, having a balance of exercise and relaxation, using alternative forms of communication with others. If you are a caregiver, sometimes having your name or a picture of your face next to you or on a tag on your shirt or something would be helpful for people that might not know who you are due to a mask and other covering. Validate feelings and encourage self-advocacy and self-expression. Have accessible, safe areas to walk around in the home or in the outside environment to increase movement and exercise throughout the day. Allow time to complete an activity. Try to plan the day and stay active and to maintain that connection with others. And ensure that all adaptive devices and equipment are available and within reach. Some activities that you can do are to reminisce, to stay positive as best you can, and do some breathing exercises. Listen to music, do enjoyed activities, expand your creativity, engage in purposeful activities, maybe have a checklist for the day and then plan for the next day. Of course, use laughing and humor, connecting with others, writing letters, or maybe sending artwork or writing cards, and engaging in the virtual experiences such as email, video chat, religious services, and support groups, and always to engage your 5 senses throughout the day as best as you can. Here are my references. And that's it. Thank you so much.
Thank you, Kayla. I really appreciate you taking the time to go over all that. There's some really interesting stuff in there. There is somebody who did have a question, and I don't know how much we have an answer for it. She has a brother in a nursing home and had wondered, you know, what are some things to keep him engaged? I know one of the barriers right now is that I've been hearing that OT, PT, and speech are happening less in long-term care facilities, including rehabs, than they used to. So I don't know, with that in mind, if you have any other thoughts on that.
Yes, I've also heard that as well. And I think that goes back to a lot of the mental health strategies, because when you're not as engaged, then that affects your mental health. But I think sometimes I've heard people doing like making scrapbooks or making like photo albums of loved ones, or with different activities that they enjoy doing, you know, using magazines or things off the internet. And really just going back to some activities and creativity that maybe were of interest at one point, whether that's trivia or bingo or an exercise class. They have several things depending on the resources, videos that you can watch just to get you moving and get your brain thinking, different types of puzzles, and really just trying to stay as active and maybe plan some of those important activities and different things. I know that therapy is definitely taking a toll in those settings right now, and it's difficult to visit anyone, but just trying to be creative in what you do have there.